So, I want to share a case from Southlake, Texas that's still unfolding and worth paying attention to. So, back in December of 2023, a young boy named Nicholas went to the ER at Methodist Southlake Medical Center twice in a short period of time. His symptoms included abnormal vital signs that should have raised red flags for something more serious. Both times, he was sent home with what his family says was a misdiagnosis of a viral infection. On Christmas morning, his condition got so bad that his parents rushed him to Cook Children's Medical Center in Fort Worth, where he was diagnosed with septic shock. So at Cook, he was immediately admitted to the ICU. He needed medications like norepinephrine to keep his blood pressure up. He went through 6 surgeries, lost about 30 pounds, and spent 34 days in the hospital. His care cost topped $500,000. Even after discharge, he's had to relearn how to walk. He's still dealing with long term fatigue, and he continues to undergo testing at Mayo Clinic. So, whether he'll ever be cleared to return to sports, something that mattered a lot to him before this, is still very uncertain. So, the family first filed a lawsuit back in late 2024 against the hospital and the physician who treated him. But when they paused that case to focus on trying to pass Nicholas Law, which would have required adult hospitals without pediatric ERs to warn parents up front when children arrive for care, that bill never made it through committee. So in July of this year, 2025, they have now refiled their lawsuit. This time it's broader. They've added the emergency nurse and the physician's employer, and they've also filed complaints with the Texas Medical Board, the Board of Nursing, and even with the police, saying this care crossed into criminal negligence. So, from a nursing perspective, this raises questions that aren't not just about blame, but about systems. Were the alarms acknowledged? Was escalation attempted? Did staffing pressures or policies create barriers to acting quickly? Nurses are often the ones expected to notice when something isn't right and to speak up, document, and escalate care when needed. So, cases like this highlight what can happen when families feel that those steps didn't protect their loved one. So, it's important to say this. This is not just about the one nurse and the one doctor that's listed there. It's about accountability across the whole emergency care system. But naming individual staff in lawsuits and even now filing criminal complaints shows how much higher the stakes are becoming. For those of us in healthcare, it's a reminder that patient safety isn't just a professional duty, it's a responsibility with very real consequences, both for the patient and for the clinicians caring for them.